Hi, my name is Dr. Louie from Northeast Medical Services Dental Department, and today we'll be talking to you about caries and how it's formed and how to prevent it. So caries or cavities, as you've heard, is normally a bacterial infection where bacteria cause food in your mouth and use that food to create acids, which will then break down the structure of your teeth. When it breaks down the structure of your teeth, it can create a small hole, which is what we call a cavity. Normally with that hole, we would see how big it would get and how deep it would get until we would need to fix it. So cavities and caries, they do not discriminate in age. It can be when you're a kid, could be when you're an adult, or even when you're a senior. So we don't want you to think that it's, oh, we don't have to worry about it because it's not to my age or I don't have to deal with it yet. So the reason why that cavities happen so often is of our diet, of foods that we eat and how we can keep it or do not keep our teeth clean. So for kids, they like to eat a lot of sugary snacks, they like to eat bread, they like to eat cookies, crackers, or even a lot of juices which have a lot of sugar. Because kids cannot clean their teeth well or do not let us clean their teeth as well as they should, that is why there would be food stuck and that bacteria can then use that food and cause cavities. Secondly, kids' teeth are a lot smaller than adults' teeth. And with that, it's a smaller, thinner area that the bacteria need to get into to create a cavity. For seniors or adults, normally it would be easier to get cavities because as we get older, we might have more health problems and we might have to take more medications. And there have been issues where if we take more medications, we can see that there are side effects of those medications that work together to create less saliva in our mouth. And when there's less saliva in our mouth, there's less saliva to buffer and move and clear out the food as well as to protect our teeth from the bacteria. So we do see that seniors do get more cavities because sometimes they can't help it because they have to take medications that would help their bodies, but ultimately might have a side effect where they have less saliva in their mouth. And for adults, we like to eat, we like to drink, we like to do a lot of things, and that means that we need to keep it clean as well. If not, then we can get prone to cavities because of our diets and our work habits or lack thereof. So the next point we're going to talk about is when do we need to fix the cavities? So cavities start where the bacteria take the food in our mouths and digest it, metabolize it, and cause acids which break down the outside of our teeth. The outside part of our teeth is called the enamel, and that is the strongest part of our body and the strongest part of the tooth. Over time, as the acids continue to break down that part of the tooth, it will kind of start a hole and they continue to go deeper and deeper. So this enamel is the hardest part, but once it breaks through the enamel, it becomes kind of like a wildfire that goes bigger and bigger. So we want to keep the cavity outside or within the enamel. And if it does get to the second part of the tooth, which is called the dentin, that is the second level and that is a softer part of our tooth. The bacteria can then continue to use that to create acids and create a bigger cavity. And if that continues past the dentin, that is the nerve of the tooth or the pulp of the tooth. And so that is where the cavities can get deeper, start to feel sensitivity, start to feel pain, and sometimes you might even see swelling in the area. And that is a point where we can't do a regular cavity anymore. It has to be something to be done called a root canal, which is a nerve treatment that we have to take out the nerve before we can fix the tooth. The worst part is if we don't do anything and it gets into the nerve and continues to do cavities, it might break the tooth down to the point where we can't save it at all and we need to take the tooth out. And that is the worst thing that we want because we normally don't have any teeth that might replace that tooth. So all that being said is how do we prevent cavities? And to prevent cavities is to, number one, brush and floss every day to remove that food from being stuck in your teeth. Number two is we want you to come back to do regular checkups so that we can take x-rays, we can do examinations and to do cleanings to prevent anything that can hopefully stop having buildup in the area or for us to see cavities that we can monitor or even need to treat. The third thing is, just monitor your diet, is to not eat very sticky, sugary foods, to brush and floss as soon as you can after you eat, probably 30 minutes after, and to just maintain good oral hygiene. That way, we don't give any of the bacteria food that they can use to create cavities, and we can keep our teeth healthy and useful for eating, talking, and the rest of our daily lives.